what I expect for you to do on the performance evaluation checkoffs for Respiratory Therapy 121, which incorporates 3 different performance evaluations in one. So it's page 3, vital signs and pulse oximetry, page 4, breath sounds, and page 5, chest assessment. There's some things I just wanted to make sure you are aware of with the simulation mannequin that will make it a little different than what you would do with a real patient. Also, just a note that you're coming into the patient's room from the very beginning. So on page 3, you'll see number 1 and 2 are very, very important. Don't forget to identify the patient using 2 forms of identification, name and date of birth. Introduce yourself and explain what you're going to be doing. Observing standard precautions just means that you foam in and foam out to clean your hands. You'll note that that's also on page 4 to do those steps, but you'll just skip those because you've already done them. So once you've done your heart rate, respiratory rate, blood pressure, and SpO2, and you've documented all of those, then you'll listen to the patient's breath sounds. You'll skip, again, number 1 and 2 and go straight to 3 through 9. Also, with the breath sounds and advanced chest assessment, this guy is super, super, super heavy. So normally you would ask the patient to sit up so that you could listen to the back of the posterior side of the chest, and so that you could also perform tactile fremitus, chest wall asymmetry, and chest percussion on posterior side as well. Unfortunately, he is very, very heavy, so there's no way to actually sit him up to do those things on his posterior side. There will be an associated small quiz that comes along with this, because as you can see, there's questions in here regarding that you should know the normal values for your vital signs. You should be able to identify abnormal breath sounds. He may or may not have abnormal breath sounds, so you will want to make sure you identify those. And then also you can see on page 5, you have to state causes for abnormal findings in 4, 5, 6, and also percussion. So with that quiz, I would probably also include to make sure you know where you would assess the breath sounds on the posterior thorax. So what I will do is I will provide a picture of the posterior thorax, and you will have to identify where you would be listening to breath sounds and where you would be percussing and doing tactile fremitus. That way I can just assure that you know where those are at. So, and I will provide that information for you as well. So without further ado, we're going to start with page 3 and go from there. Good morning, Mr. Jones. My name is Lindsay Fox, and I am with Respiratory Therapy, and I am here today to perform a patient assessment. We're going to check your vital signs, your breath sounds, and some other things. Is that okay? Okay, can you please tell me your full name and your date of birth? And we'll say that you did that. Okay, great. Thank you so much. All right, we're going to go ahead and we're going to start, and I'm going to first do your heart rate. Okay, so if I can just look here and feel your wrist. Let me write that down real quick here. Now I'm going to also check your blood pressure here. oxygen you have in your blood. Looks like it is 95%. That's good. Okay. Next thing we're going to do is I'm going to listen to your breath sounds. So what I need you to do is I'm going to close the door here. Make sure everything's quiet. I'm going to have you, every time that I move my stethoscope, just need to take a bit of a deeper breath than normal and do so with an open mouth and then just exhale normally. Okay? And inhale. Inhale. Again, normally I would get your back. That is hard to do. All right, so let me document that real quick. Okay, so the next thing I want to do is I'm just going to inspect your chest wall. So I'm going to just look at the configuration of your chest wall to make sure it's in normal shape. I'm just going to look at your color of your lips and your fingertips, see that they're not cyanotic or pale. And then also I'm just checking for your breathing effort to make sure you're not using any accessory muscle use or nasal flaring or paradoxical movement or anything like that. Normally I wouldn't tell patients I was doing all of that because I wouldn't want them to change their breathing, but I need you to say it out loud just so I know that you know that you're doing that. Okay, after that, Mr. Jones, I am going to, next I'm going to check how well your chest wall is moving. So here I'm going to put you up a little bit more here. Take this down so I can get here, and I am going to have you take a deep breath in. I'm going to check to see how much my fingers move here. So deep breath in. And let it all out, blow it all out, blow it all out. Inhale in, big deep breath in. And exhale it all out. And one more time, big deep breath in. Exhale it all out, big breath, big, big, big. Okay, and again, my fingers don't move much with his chest wall, but again, you can at least demonstrate the technique. Okay, the next thing I want to do is called Tactile Fremitus, and what this says is I'm going to be putting my hands onto your chest wall, and I need you to say 99. So every time I place my hands on your chest wall, just say 99 and just keep repeating it. So 99, 99, 99, 99, 99. Okay, and again, I would do the posterior side as well. Okay, Mr. Jones, I just want to look at your trachea here, and I'm going to just check here that your trachea is midline, and it feels like it is right there in the middle, okay? And last but not least, I am going to percuss your chest. So what this means is I'm going to tap on your chest and listen to the sounds that it makes. Okay, so don't need to do anything, but just breathe normally. And then I would do the posterior sides. Okay, I'm going to go document that.
twist the drill back up for your safety.
Do you have any questions for me? Anything that I can get you? Okay, well thank you so much. I'm gonna make sure to wash my hands on the way out, and I thank you for your time.